Title?
Jennifer Romero, and I'm a registered nurse.
And you spell Jennifer for me?
Jennifer.
And you spell Romero for me?
Romero.
Oh, perfect. And what are you doing here today?
We are here testing for the coronavirus with the residents of this facility.
Okay.
And also the caregivers.
Okay. And who are you testing?
Testing the residents.
Okay.
Yeah.
Yeah, excellent.
Yeah.
So it's obviously kind of unique, right? Bouncing around town, testing people at different assisted living facilities and nursing homes and what have you.
Yes.
I saw I saw one lady that was not really understanding what was going on, and you definitely kind of sat there and kind of broke it down and did your best to explain it to her. Obviously super patient of you. So what's it like to kind of go through that experience for you?
Well, sometimes it's a little challenging since some of the residents or the patients that we are swabbing are a little bit older. So, there could be different ailments that they just don't quite understand. So it's getting around that barrier, being able to explain why we're here and that we're doing this to make sure that they're healthy and that the facility that they're in, stays in that manner as well.
And why is it important for them to get tested?
It's important because then that way we can know what protocols each facility needs to go by. So if, let's say, for example, if one of the patients do end up positive with COVID, then it's like, okay, are we isolating them? Are they showing any symptoms? Are they symptomatic? Do they need, medical treatment, such as, taking them to the hospital? That kind of thing. And then we also want to contain it so that way other residents or staff members aren't, they could potentially be vulnerable as well. So we want to make sure that's why we're kind of ahead of the game to make sure that they are being tested so we can kind of follow up from there.
Excellent. Well, did you have any training in particular? I know obviously you're a nurse, right?
Yes.
So there's training in that, I'm sure.
yeah, a lot.
but obviously before you came out here, was there any training as far as with the PPE you were wearing or the process or swabbing or anything like that? What's that like for?
Absolutely. Well, also because of my knowledge, being a nurse, I do work for a huge organization, a hospital, and so I'm a float nurse. So then basically we have to know how to do don and doff PPE, putting it on, taking it off. We're dealing with different patients. So taking that and bringing it here, they also supplied more training just to make sure we are all on the same page, and then making sure that we're going into each facility and teaching them how to also use this PPE.
So you're teaching the facility how to use the PPE, like the proper mask and stuff? And when you say they trained us, you mean the Department of Health?
The Department of Health,
okay.
Yes.
Excellent. You're also here today working with the National Guard.
Yes.
I know you're doing swabbing, and they're kind of helping out as well. So what's it like working with the National Guard?
Well, this is actually my first time working alongside with the military, so it's been fabulous, very, very good. We're all in it for the same purpose, to make sure we're testing these, residents, the facility, or also the staff members. But it's very nice because it's been flowing very, very well. We've all kind of come together, we kind of brief about what we're going to be doing, and then just everybody has their different jobs, and then we just have really collaborated wonderfully together. So.
You have any questions, Morgan? Anything else you'd like to add that I didn't ask you about?
Not really, except I really have appreciated working, with the National Guard. It has been a very life-changing thing.
Excellent.
It's awesome.
Well, you can always join.
Yeah.
Give me your first name, your last name.
My first name's Alan Joy.
Spell your last name.
Joy.
Spell your first name.
ALAN.
Excellent. And what's your position?
I'm a registered nurse. I'm currently serving as a team lead for Strike Force 2.
And who are you working with or working for?
I'm working with the Department of Health and State Emergency Response Team.
Well, so what's that relationship look like? So does one report to the other, or how's that?
They're working, they're joining together and with missions. So depending on the missions, they disperse out to the State Emergency Response Team.
So it's kind of like a dual role with the State Emergency Response Team / Department of Health.
Yes.
Also, try not to sway. Sorry.
Okay, sorry.
Yeah, no
I didn't tell you that.
Again, you may be me, so it's probably my fault. So I apologize, Alan. So how long have you been doing this with the State Emergency Response Team?
We've been doing this for about 3 weeks.
Okay. Working at the strictly mobile
Yes,
testing?
we're based in Jacksonville. We've been going to nursing homes on different facilities, doing a lot of education, infection control, swabbing residents, staff members.
You've been working with the National Guard a lot, or is this like the first time?
This is the second day that we've been working with the National Guard. They've been great. They've been helping us. We work well together as a team.
They make things easier?
They make things easier. They bring their operation mentality and logistics and helps guides us throughout the whole process as well.
And what exactly is their role? Like what part of? Because I know your team's in the swabbing, right? With the National Guard.
So my teams mainly have patient care. So we're hands-on with the patient. They're kind of on the back end scenes, making sure we're validating we have the correct information for the patients, making sure we have the correct mission number, and make sure that everything's correct.
What about, so you have a team, how big is your team?
Currently we have 8 nurses. They're all registered nurses.
And what's it like to be a team lead and leading them?
It's interesting. It's like a small family, so we all met about 3 weeks ago. So none of us knew each other before this. So we actually grew into a family, and even outside of work, we've been hanging out and getting to know each other as well.
So things have been going pretty well, and everyone's working well and seamless.
Yep.
Excellent. And what's been kind of the reception from like the people that you're testing?
The reception, they are at this facility. They were definitely blessed. A lot of the residents and staff members thanked us. Sometimes they can't get out to the testing sites, so coming to them, it helped out.
And so how does this get organized? Real quick, take a step back. So I know the National Guard gets a mission, and they reach out to you, or you get tasked for the same mission, or do you know how it works?
There's different missions. So the IMT reaches out to. Once they get a mission, they'll reach out to us and let us know what the plan for the day is, or what the mission is. We take that mission and basically fulfill it. We'll go contact the facility and make sure that they know that we're coming, not just showing up, and we're trying to do the right thing. I know when we say we're coming from the Department of Health and the state, they get a little anxious, but we want to be calming and make sure that we're here to help and guide them.
You have any questions? What's like what would be your message to anyone? You know, really, whether it's you want a message for the Department of Health workers or Florida National Guard soldiers or people that should get tested. Do you have anything else you'd like to add?
Yeah, I feel everyone should get tested, have the correct information, do their research. I know there's a lot of news out there that may be worrisome. Just the main thing is wash your hands, maintain social distancing, and do the right thing. The biggest thing, especially in these nursing homes, is the caregivers are actually the carriers. So we want to make sure that we're spending time and taking care of the patients. You have to help yourself before you can help others.
Excellent.